morning, everyone. Welcome to this AM Upskills webinar. My name is Georgia Seago. I'm editor of Aesthetic Medicine, and I am joined by Kat Coleman, who is training ambassador for Mesoestetic. This session is sponsored by Mesoestetic, and we're going to be talking all about microneedling with transepidermal solutions this morning. So welcome, Kat. Thank you so much for joining us again.
Thank you, Georgia. It's nice to be here. So thanks for having me.
Okay, so you've got a presentation. So what we'll do, I will let you start sharing your screen in just a second, and then I will disappear. If anyone's got any questions during the webinar, then please do pop them in the chat box, or if you're watching on, I think, yeah, we're streaming to Facebook. If you're watching on Facebook, just pop your comments in the questions, your questions in the comments, and then I will come back on at the end and we'll do a Q&A session with Kat. So we will try to get through all your questions. So I'm going to disappear if you want to start sharing your screen, Kat. And then it will be over to you.
Thank you. Okay, thank you for joining me today. So yeah, as Georgia said, I want to introduce you today to how we do microneedling at Mesoestetic. So I'm going to be really focusing on some awesome transepidermal solutions that are an essential integral part of microneedling treatment. So I'm going to start by introducing you to Mesoestetic.
At Mesoestetic, we understand skincare as a science based on clinical evidence, rigor, and excellence. By merging medical and cosmetic knowledge, by studying cell behavior and molecular mechanisms, we can pinpoint the cause and design the precise formula. We develop cutting-edge aesthetic medical solutions born from years of research and supported by proven results for the most demanding skincare experts. We believe that interdisciplinary treatments provide limitless therapeutic approaches to target every skin need. Because we are scientists of beauty, and this is the element that makes us unique.
So, this morning I'm going to introduce you to the perfect tool to treat any aesthetic imperfections using our high quality transdermic solutions, which are called c.prof. So let's start by looking at why microneedling with Mesoestetic. You can see there the image of our m.pen Pro, which is our microneedling device. So microneedling is a minimally invasive technique, short procedure, minimal downtime. It is the kind of treatment that your client could come in on the lunch hour, have it done, and off they go and continue with their normal daily routine. It stimulates tissue regeneration processes as a response of micro damage. And so basically it's creating a controlled trauma. And by doing that, the skin then goes into panic mode and need to heal. And therefore it will do that by starting to go through the wound healing process and stimulating collagen. In addition to this, we've created tiny little micro channels. And these then allow for penetration of active ingredients into the skin. And these two mechanisms make up the true concept of this treatment, because you'll get half of your result from the actual mechanism of microneedling by creating the micropunctures. And then half of the result will come from the ingredients that you're delivering into the skin through the microchannels. So we use an automatic device. It's really, really easy to use. It's light, it's wireless, and it will allow you to offer the same pressure, depth and distribution on the treated area. And this is great to really ensure regular results. It doesn't scratch the surface like other tools do. Microneedling device works perpendicular, so in, out, as opposed to scratch, scratch, scratch. So you get a much quicker epidermal recovery. It's pen-shaped, handy, portable, efficient, and easy to operate. And it's exactly that. It's really, really easy. It's got 5 speeds. You will change the depth by swiveling the head of the device, so it's really, really easy. And portable, it means that you can walk around the bed and you can get into nooks and crannies with the device, and you're not getting tangled up in a wire. Face and body indications, and even for hard to reach areas, and it's a widely used technique to treat aesthetic imperfections. It's also great to combine with other modalities. For example, you could perform a mesoaesthetic mesopeel on the skin and then go directly in with microneedling as well. And we know that time is going to be an issue when the clinic's open, so you may have a half-an-hour appointment for the client and you want to get as much treatments done within that time. So this is perfect to really combine. So let's have a look at how microneedling actually works and what does it do. So minimally invasive therapy creates micropunctures to stimulate the collagen, and these leave behind tiny little microchannels. And then the channels allow for the solution to penetrate into the deep layers. And this is how we achieve a double action. So it's how we are unique at Mesoestetic. We're not just using the device on its own, because that's only going to create half the result. You're going to get much better penetration of the right ingredient, and it's important that these ingredients are formulated for penetration. You don't want them to sit as a thick glidey slick on the surface of the skin. You want a thin solution that's going to penetrate fast and 1,000 times quicker. So who's it for? If I'm honest, you can do microneedling on pretty much every concern apart from active acne. But it's brilliant for scarring, acne scarring, trauma, surgical scars and marks. Pigmentation disorders. Now, this will be used as part of a program for pigmentation that would also include tyrosinase inhibitors. You may combine it with peels, and it's really essential that with pigmentation, the home care is used alongside. Skin flaccidity, double chin. So you can use the device and the solutions to kind of break down these lockdown chins that a lot of people are concerned with. Stretch marks. Now with stretch marks, it's great if they've still got the blood running through, so those red, pink stretch marks. You will get a result on the white stretch marks, but it's more about evening the tone of the skin and improving the condition of the stretch mark and around. So I'm not going to say it will completely disappear, a silver white stretch mark, but it will massively improve it. Cellulite. Fine lines and wrinkles, one of the most popular reasons it's used for as well. Sagging skin, so great as well if you've got a client that's maybe lost weight and they've got a sagging area or a stubborn area and they want to kind of tighten that skin, lift it all back up into position. All skin types in terms of phototypes, which is brilliant. All skin concerns, like I said before, apart from active acne. If you've got a client with a couple of blemishes, it's easy to work around, but if they have got you know, quite a large representation of active acne, I would always recommend that you treat the active acne first, get that under control, and then you would consider. And it's always something where if you are dealing with a client with acne, this is something you're going to present to them that would come into their program further on down the line. So for example, you would get the acne under control, and it could be that they will be left with acne scarring, and the acne scarring could actually be pigmented as well. So this microneedling treatment quite often comes into a routine for treating acne. Hair loss as well. I'm going to show you how you can use this for different types of alopecia and hair loss. So let's have a better look now at how it actually works. So we've got the micropunctures, and this is where we are creating a controlled trauma, and it initiates a chemical cascade which will start to stimulate growth factors, cytokines. This then leads to a stimulation of formation of fibroblasts, and as we know, the fibroblast cells then start to stimulate collagen, and what is absolutely essential here is the generation of collagen type 1, 3 and 4. Now collagen 3 is your wound healing collagen. So if you've got a wound, a trauma, acne on the skin, it's the collagen 3 that starts to heal it. And what's great is collagen 3, once initiated, will turn into the stronger, more supportive collagen 1. We're also generating elastin and glycosaminoglycans. So that's one half of the treatment. That's what the device alone will do. But the second half, which completes this treatment, is using these microchannels. You've created thousands of little tiny holes all over the skin. Let's fill them up with something great. And this is where we use active ingredients. We are a pharmaceutical company that has the ability to produce active solutions that are able to penetrate into the skin. You're going to get a better entrance of these active ingredients because basically the skin is open for it all to go in. A greater absorption, so you'll get a deeper penetration, which then will allow for the maximization of treatment efficacy. So it's really good to have that confidence thinking I'm going to get some awesome results here for my client, not only from the mechanism of microneedling, but also from these active ingredients, which is what I'm going to introduce you to as well today. So the micropunctures, also known as collagen induction therapy, there's a great diagram here, which I think is good for clients to see because they can relate to this. So you can see a little cross section there of the skin and a deep line with minimal collagen. And after the treatment, you can see that abundance of collagen. The surface of the skin is a lot smoother. And again, exactly the same with the penetration of active ingredients. So you can see if you topically apply a product to the skin, it will trickle in. But if you have the microchannels, it's going to go in much quicker, much deeper, and in a purer form. Let me introduce you to the actual device. So this is our m.pen Pro. It contains 2 lithium batteries, and it's only the battery part that you will charge by putting the lead into the bottom. So the batteries come off, you can charge them on their own, you can attach it and charge whatever's easiest, and it's charged with a USB cable. Each battery will give you approximately 2 hours full usage, which is a long time. You very rare if you're doing a treatment if this device is on for 2 hours in one go. It's normally on for about 10-15 minutes at a time. It's really, really light. It's literally, it's like a pen. You have 12 sterile stainless steel needles in the cap, and these are individually packaged. See, everything is CE marked, and they are one use only. Wireless, silent device. You will hear a slight vibration, and that's from the speed and the penetration of the needles. Now, this is what's great because you've got the option of changing the speed, and you may want to do this when you work and focus on different areas. So, for example, if you're working around the eye, you may want to slow down your speed and be a little bit more intricate with your penetrations, whereas if you're working on a larger area or the body, you can have it on fast, and it allows you to change this throughout the treatment. So it's very, very adjustable for the client. And then you've got the depths, and the depths range from 0.25 millimeter through to 2.5 millimeter, and you twist the cap to the indicator of the depth. So you've got 5 speeds and 6 depths, so there's a lot of range here, which is absolutely brilliant. Now, the depth that you will choose will differ depending on the area, and this is just an example of a cross-section of the skin. So with microneedling, it's been around quite a while now, and we learn a lot about microneedling, and it's definitely evolved. I think about when I started microneedling 12 years ago, it was actually performed quite differently, and the end point to that was bleeding. But over time, experience, knowledge, it's been proven that that is not your endpoint. Your endpoint would be erythema, because that is initiating the wound healing process. So it doesn't need to go as deep as previously thought, but you will change your depth. I'm going to give you an example. If you're working around the eyes or on the scalp, you would work on around 0.25 millimeter. If you were doing acne scarring, it could be 1.5 millimeter. The body generally is 1.5 to 2.5. So you will, as the practitioner, you will assess the skin in the area that you work in, and you will change the depth accordingly. Skin health, as we know, is so important. So it's really, really important to achieve this. This will not only obtain the results, but also maintain them as well. And at Mesoestetic, we do this really easily. We've got 4 great kits. We have lots of different products in our ranges and in our solutions, but these are designed very specifically. So I would always recommend, you need your clients to be using the best home care they can, because that's where they're really going to see the awesome results, but also maintain it. So these 4 kits here, we have age management. So for anybody concerned with aging, even if it's age prevention, back off aging, I'm not ready, or if it's, oh my goodness, it's already here, it's well established, I want to reverse as much as possible, I don't want to get any worse, then the age management kit is for those clients. Acne management, depigmentation, sensitive skin kit. You may be using the sensitive skin to encourage the health and reduce the skin from being compromised prior to treatment. We would always recommend that they start to use the good quality home care and these kits for a minimum of 14 days prior to the treatment, and of course throughout and then post as well. So home care is just as important as the treatment that you can offer them in the clinic. In addition to the kits, we have some key essential hero products to aid the healing, the repair. You need to soothe the skin. Post-treatment, you may find that they're red. I call them Jerry the Berry. So it's normal for the skin to be hot and red. So we want to address these concerns. One of our hero products that most of you will be very familiar with by now is our post-procedure fast skin repair. The one that repairs the skin fast. HA Denser Matrix, the ultimate dermal hydrator. Collagen 360 Essence is to stimulate collagen, and of course SPF, which is essential. So I want to introduce you now to the ampules. You can see on the screen a very nice little demonstration of the device in action. The device is moved quickly across the skin and in very, very small sections. We generally will do this dry on the skin first, because the idea is to achieve the microchannels, and then we're going to allow for penetration of these solutions into the skin. And so you would use different techniques, and you would create the microchannels first by vertical, horizontal. And then, as you can see, apply the solution, and then you can go back on the skin again in circular movements, and then apply the solution further. But these kind of techniques is what we would show you in training, because you can change your technique depending on the area, the condition of the skin. But it's just showing you a nice little example. So the actual solution goes onto the skin twice. You want to achieve the microchannels first, and then allow the solution to penetrate in. So you can see there me applying the solution, and it's in a Lure slip syringe with no needle on the end. And you would draw it out of the sterile glass container into a sterile syringe, and then it's applied directly to the skin. So let me introduce you to the c.prof ampules. And the C in c.prof means pre-cocktailed. It's done for you. You don't have to think about it, and it pretty much does what it says on the tin, which is great. And it's going to allow for these active ingredients to penetrate up to 1,000 times quicker. So the c.prof range is very advanced. active ingredients, and each vial just contains 3 or 4 of those active ingredients. It's got a really nice high pH, so we're not causing any irritation. It's balancing on the skin, and it's all free cocktail for you. So let me show you the answer to lines and wrinkles with microneedling solution, and this is Mesotox Solution. And Mesotox is formulated with arginine, acetyl hexapeptide 8, and also pentapeptide 18 and niacinamide. And those 2 particular peptides in here work at preventing the release of acetylcholine. And what that means is the muscle is not getting the message to contract. So therefore, it's going to be preventing muscle contraction, which leads to reduction in the lines and wrinkles. So the Mesotox can be used predominantly for lines and wrinkles. You can also use it alongside toxins, and it speeds up the performance if you've got a client that's maybe due their toxins, or they don't want to go down that route for whatever reason. This is an alternative, but also can be used alongside. So the Mesotox Solution, lines and wrinkles. I'm going to show you a before and after picture here. Now, this was after just 1 session, and you can see that they observed at Mesoestetic Pharma Group an immediate onset, but this effectiveness increased after 24 hours. So the picture on the left here was just before the treatment, and the picture on the right was 24 hours after. So you can see an immense result there, and that's what you're going to expect with all of these solutions and this treatment. So let's move on to photo aging solution. This is a very, very popular, and it's one that everybody can benefit from. We all want luminous skin, we all want hydration, and we're all probably subjected to some form of photo damage. This is great for toxic skins, smokers, party goers, late nights, those that know they neglect their skin and they dehydrate. Your main ingredients here are hyaluronic acid and vitamin C. So you've got your little bodyguards of antioxidants in here. So great for stress, fatigue, smoking, solution, addressing dehydration and a lack of luminosity. And that's the photo aging. Now, Mesopeptide is this: lifting, firming, tightening. And again, we are using peptides, acetyl tetrapeptide 9 in particular, and it stimulates the action of lumicin, which is a proteoglycan. And this is great at creating that scaffolding in the skin, strengthening, supporting the extracellular matrix. So lift, firm, tighten. So if you've got those clients with kind of sagging areas that really need to lift it all, then the Mesopeptide solution is the one. Okay, let's move on to depigmentation. Now, you know we are famous for the Cosmelan and the Demamelan, and that is a treatment method. And this solution actually appears in that protocol, and it may be come into the protocol 4 months down the line, or it's the alternative and you start their program with this solution. The main indications for this are post-inflammatory hyperpigmentation, age spots and freckles. And the ingredients in here, we've got tranexamic acid and acetylglucosamine, vitamin C, idobenone. So you've got an abundance there of tyrosinase inhibitors and vitamin C, which are essential for not only protection and repair, but also regeneration. And when you're using the depigmentation solution as part of a depigmenting program, you will also have tyrosinase inhibitors in their home care. Of course, they've got to be using an SPF. So that's when you'd really consider the depigmentation skin kit as well. This is showing you a diagram of PIH on the skin, and it's after 5 sessions, and I've seen some really great results from this. So the depigmentation solution, post-inflammatory hyperpigmentation, age spots and freckles. Acne scarring. Now, this is a really, really big one for microneedling. And when you're looking at acne scarring, you've got different types. And also what you've got to bear in mind is that it could also be linked to PIH, because they could have the pigment with scarring as well. And we have an awesome ampule for you here called Skin Mark Solution. And it's actually used for two main indications. And the first one is acne scarring. So there's a couple of examples here on the slide of different types of acne scarring that you may be faced with. Rolling scar, ice pick scars, and the box scars. So you can be using the microneedling device because that on its own for collagen stimulation is awesome for acne scarring. But if you're going to start to add in essential ingredients to really combat and work on it, then the results are just endless. The other side of Skin Mark Solution is stretch marks, and I mentioned this earlier. And stretch marks obviously can be anywhere on the body, but definitely the hips, the flanks, the peri-umbilical area, so post-pregnancy, etc. So if you've got a client that's concerned with acne scarring and stretch marks, or they don't have to have both obviously, then the Skin Mark Solution is the best one. And your ingredients, you've got organic silicone in here, XDNA, which is great for repair, regeneration. We're stimulating tissue regeneration and really, really stimulating that collagen proliferation. So the Skin Mark Solution, acne scarring and stretch marks. And here is a picture of stretch marks. Now, I mentioned earlier about when they're white and silvery, and that's what you can see here, but they've still got a slight pink outline. So like I said, when you've got a white silvery one, it's really difficult to get rid of it completely, but what you can massively do is improve the appearance. Whereas if they are just red and pink, then yeah, you're going to get them disappeared quite quickly, which is brilliant. So this one here is after a course of 10 treatments for the stretch marks, and it's dramatically reduced. So Skin Mark was acne scarring and stretch marks. Now, if the acne scarring is pigmented, use the Depigmentation solution. So we started to touch on body areas, and these are the main kind of areas in question. Legs, the breasts, the buttocks, abdomen sides, double chin and arms. So you can use microneedling if they've got stubborn areas of concern. And when you are doing a complete figure concern treatment, we'd always recommend you start with drainage, because you want to get everything moving. You want to get the circulation, anti-edema, anti-inflammatory, diuretic properties in this one. So you'd start a program with getting everything draining so that you've got that decongestion, antioxidant, moving everything out. So then when we do start to break down the fat with the lipolytic, it's already used to draining. So it's just going to break down the fat and drain it out. Which brings me on to the lipolytic, which is for localized fat. So if you've got a client that's got stubborn area, maybe they've been losing weight and they've got, oh, I've got one area that I can't shift, or maybe it's the double chin, etc. Then we have the Lipolytic Solution specifically for this. So again, within that program, you would do a draining treatment, then the breaking down of the fat, then you might do draining and then breaking down of the fat, and then you may finish with firming. So you would incorporate all of the body ones into a program. So the Lipolytic Solution, main ingredient L-carnitine, which has a great action of breaking down the fat. You've also got artichoke in here, which is, again, really good for draining, diuretic. The lipolytic one is great for reducing the size and the number of the adipocytes. But again, you're going to use this as part of a full body contouring program. And then they want to firm it all up. So we've drained it, we've broken down the fat, and now let's firm everything. So the loss of skin elasticity and firmness occurs due to degradation of collagen and elastin. What's the treatment doing? Stimulating collagen. So this is perfect for firming the skin. And the ampule that we use for body firming is called body firming. So really, really easy. One of your main ingredients in here, DMAE, is again firming, lifting, tightening, and it does offer an immediate lifting effect. Organic silicone as well, sodium pyruvate, which is stimulates your peptide, amino acids, and also collagen stimulation. So this is showing you a great picture here of double chin, and what was 7 sessions here. And so it was started with draining, and then the lipolytic, then draining, lipolytic, and firming. So you can see how within each treatment you would assess where you're up to in the program and then use the correct ampule accordingly. So we move on to cellulite. Now, cellulite is something that needs to be treated as part of a full program. So this is great to incorporate into many other modalities that you could already be offering. And there's different types of cellulite, which I am going to show you now. Microneedling is great for if you've got those stubborn kind of surface pockets left. So you might have a client that's already on a contouring program for cellulite and they've still got stubborn areas left, and it's great to incorporate it into any cellulite busting program. Caffeine always interests me, because you think you're told not to drink caffeine because it can cause cellulite, but actually we use caffeine to regulate lipogenesis and stimulate lipolysis. So it's kind of doing what it can also do if you're drinking it. So it's great. So you want caffeine in the ingredient. You've got capsaicin, increases microcirculation, carnitine again to breaking down the fat. So you can treat all types of cellulite, but personally it's great if it's more that kind of surface pockets. But I would always incorporate the Cellulized shock solution into other cellulite busting modalities as well. And then the final one that I would like to introduce you is our hair loss solution. And this is a treatment that's becoming a lot more popular. There's lots of different treatments for hair loss, and this is one that certainly is going to have a great effect. So alopecia is when your client will lose more than 100 hairs a day, and there's so many different factors to hair loss, and it could be hereditary, physical, emotional stress, diet, medication, pregnancy. You need to establish the type of alopecia, the type of hair loss and the triggers before you're able to treat this effectively. But hair loss can be linked to other kind of diseases as well. So you want to, really important to gain as much information. Triggering factors, genetics. It affects many men and rarely women. You can have alopecia areata, which is where the hair can fall out in clumps. Traumatic alopecia, where it's subject to trauma, such as the hair dryers, the straighteners, the curling tongs. Diffuse alopecia, where it could be hormonal changes and also side effects to medication. Drug-induced alopecia, hereditary. So you've got to get to the root of the cause, and then you'll be able to treat successfully. And the hair loss solution contains a complex of vitamin B, so particularly dexpanthenol, vitamin B5 and vitamin B8 biotin. And these are really good at restructuring, stimulating that follicle. When you are, I'm going to show you these images that you can see on the screen are actually from our customers. These are ones that were done in the labs. They were done real life in the UK, which is great to see. So when you are doing a hair loss program, again, you've got to encourage the support products. So we have Trichology shampoo and lotion, and the lotion is applied every other night, and the shampoo is used as and when they would naturally shampoo their hair. So obviously they don't need a skin prep kit for this, but this would be their routine that they would be using the right products alongside. So we're looking at stimulating the micro stimulation in the follicle. The penetration for this is quite superficial, because what you don't want to do is bypass the follicle and have the solution go beyond it. You want it in, and you want it at the bottom doing its work where it needs to be. And that concludes the solutions, the microneedling system with the m.pen Pro device. I hope you've enjoyed this today. You can see our contact details on the screen here. Our website is mesoestetic.co.uk. You can email us, contact@mesoestetic.co.uk. The telephone number is 01625 529 540, and of course you're going to find us on social media and all the platforms such as Facebook, Instagram. We're on LinkedIn, we have a YouTube channel, so any questions at all you can contact us, and we are very happy to assist you. So I really hope you've enjoyed this today, and we'll see if we've had any questions.
Thank you so much, Kat. That was wonderful as always. Lots of really interesting and useful information there, so thank you.
Thank you very much.
We've had quite a few questions, so I will get to them. They'll be kind of bouncing back and forth a bit between specifics, but that's fine, you can handle that.
Yeah.
Okay, so first of all, someone has said, I would like to add microneedling onto dermaplaning, I guess in a combination treatment, but they said, I've heard mixed things. Some people say it's too much trauma on the skin, others include it with their dermaplaning facial. What's your opinion?
Okay, this is a personal opinion, because obviously we don't use dermaplaning at Mesoestetic. My only concern is any kind of surface trauma that you may cause from dermaplaning that you won't be aware of at the time. Dermaplaning is a treatment that's, it's used, it's popular. We don't encourage these treatments to be kept together. I would, however, do a peel with the treatment, because you are more in control and you are less likely to nick the surface of the skin. And that's why I don't like it, because you don't want to nick the surface of the skin and then go on to the microneedling device. But that is a personal opinion. There will be people out there that will do this, and if you get great results, then why not? But I can't say yes to do it.
Okay.
Keep it separate.
Okay, thank you. Okay, are products used before or after the procedure? That's both, right?
Yeah, I'm assuming. Okay, I'll just tell you everything we use. So before the procedure, you're going to cleanse the skin, you will sterilize the skin and prepare the skin properly. If you are using a numbing cream, you may apply it, and that's used in certain circumstances, i.e. depth, dependent on depth. So when the skin is completely sterile and you are ready to start, then we always recommend that you achieve the microchannels first and then apply the solution. I get asked this question a lot, because people say, oh, do you not need a glide across the skin? No, and that's down to technique. The pen is not designed to scratch the skin, and if you follow the movements that we will show you, you're not going to cause dragging. That's what people have the fear of. So think about it logically. You want to create the holes and then the solution go in, but if you feel more comfortable of having the solution on the skin first, then you can. It's just logically it's better to do it dry than solution. So products used before, then throughout, and then of course post. I think that answers that question.
Yes, I think that was a comprehensive answer, thank you. Okay, this is a good one. Do you recommend the use of numbing creams when microneedling?
Okay, yeah, and I get this a lot. On occasions, that's what I would say. If you've got a good technique, you don't need numbing cream for anything up to kind of 0.75 to 1 millimeter depth penetration. With numbing cream, you've got to make sure you have applied it properly, thoroughly, followed the manufacturer's guidelines, but the most important thing is it's got to be removed thoroughly from that skin. And then you're going to need to sterilize the skin. This is what I personally do. If I'm doing anything up to 1 millimeter, I don't use a numbing cream, but if I'm going beyond that for maybe acne scarring or the body, then I would. But I like to do a lot of combination treatments as well. And if I was going to perform a peel prior to this treatment, then there's no room for microneedling, for numbing cream. And the idea then is you're going to be dropping your depth, because don't forget, the end point is erythema. It's not bleeding, so you don't need to be as aggressive. Remember this, you can get dermal stimulation, dermal wound healing from epidermal stimulation. As soon as you've created redness and inflammation, that has then initiated the wound healing process. And we go into this in great detail on the training. And so when you truly understand how the skin responds to an injury, you'll realize then that it doesn't need to be as aggressive, which would then warrant numbing cream. So it's not a yes, you need to do it, and it's not a no, definitely don't do it. It's a, it will be used on an individual basis depending on what you're treating.
Cool, thank you. Okay, does the m.pen come in a bigger size for working on larger areas?
No, it doesn't. So it doesn't need to, because you're going to keep your movements small. So even if you had a larger head, you're doing small movements regardless. So no, it doesn't need to.
Okay, cool. Sam Scott has said, hi, Kat. And then Monica said, love the age management kit. Okay, how much is the m.pen, or is that something that people are best off kind of getting in touch personally about?
Yeah, get in touch with us. I mean, I can tell you the price of it anyway, because it's something that we're really proud of. The m.pen, if you wanted to purchase the m.pen, we do sell it on its own, but and it's only £850. However, people never ever buy this on its own, because we do a great opening package, and it's around £999 plus VAT, and that includes the pen, the ampules, the needle heads, the back bar products, absolutely everything. So it's fantastic, and obviously training is involved. Another question I get asked a lot is, how much do the needle heads cost? And they're £4 each.
Cool. Great, thank you. Okay. How far under the eyes can we needle, and at what depth?
Okay, 0.25, and you can go quite close. Now, we have a very specific treatment called the Global Icon, which is a peel and microneedling for the eyes. And we will train you to work very, very slowly right under this eye area, and you can also use it here. If you kind of, where you can feel your socket line, but you can pull the skin down, you're very, very slow and precise with your movements. So yeah, we will train you how to work around the eye.
Great, thank you. Okay, we've done that one. This is again probably one that's very much dependent on what you're treating, but how long should the whole treatment take, or would the whole treatment take?
About half an hour. Yeah, if you're just doing this, if you're combining a peel, to be honest, I would still probably do it in half an hour, and that's from getting the client in, getting them done, and getting them out again. So really, really quick. But if you're adding numbing cream in, then that's going to increase your time. So, but on average, 30-minute treatment time.
Okay, great. There's a few questions about training, so I'm going to kind of group them together at the end. Is microneedling safe for acne rosacea?
We don't treat acne rosacea with it, but I do know you can, but I won't train you to treat acne rosacea because we haven't tested its efficacy in the labs. So we will only do something that we know we've got experience with. So I won't train you to treat acne rosacea. It scares the life out of me because I've had acne rosacea. I would actually guide you down another route, but I have heard you can, so I'm going to leave it at that.
Okay.
If it is acne rosacea, there's peels that can be done, and there's products, so I would take you down that route first.
Okay, cool. Same person asked, can we use c.prof intradermally?
No, because it's not CE marked. When you are injecting, so if you wanted to do mesotherapy, which is different than microneedling, then you legally need a CE marked injectable use only ampule. And a lot of people get this confused and they call microneedling mesotherapy, and it is, it's microneedling. Whereas mesotherapy is injecting something between 1 and 4 millimeter into the skin, but no, it has to be a different composition. But we do have those. We have a whole range for injectable ampules. So if it is something that's what you want, don't worry, we do have that as well. And it's called Vial.
I'm happy you mentioned that, actually, because we've had 2 other questions around meso. So someone said, are the ampules suitable for injection? So your answer would be no, but the meso ones are.
Yes.
That's
it.
And then also can use the ampule products for mesotherapy as well as microneedling. So no, they're separate, aren't they?
Yes, yeah. If you want injectable ampules, we've got Vial. So just send us an email and we'll show you exactly what those are. They are similar, but they are developed differently, have a higher composition of hyaluronic acid in there, but they have to go through a different process to be injected into the skin.
Yeah, okay, great. Training. What is the rough estimate of treatments to get results? Someone's saying their clients always ask this, so
yeah,
how many?
That's what I'd want to know. When am I going to see the difference? Okay, so on average, it will depend on what you're treating and the depth of the needle. So generally, if it's a facial concern, then an average, of course, of 6. If you're dealing with something like acne scarring or stretch marks, now it's going to range from a minimum of a course of 3 to maybe more. And the reason it's different is because you're going at a deeper depth and you have to give 6 weeks in between for collagen proliferation. So you are going a bit deeper and stronger. So it might require less treatments, but spaced apart a little bit more. So on average, we always work around course of 6. But don't ever guarantee your client, after 6, it's going to go, because you can't guarantee what they do at home.
Yeah, of course. Okay, great. Oh my God, we have so many questions. Okay, I've got them.
If we don't manage to answer your question, if Georgia doesn't manage to get through it, then you can just contact us anyway. Yeah. Do you want me to explain how the training works? While you're looking at the question?
Why don't you do that now, and then some of the more technical ones after.
Okay, so we have a really easy, great training program, and obviously due to lockdown, we have been able to write an awesome program that is accessible online. And there are prerequisite requirements where you would watch some seminars. One would be on consultation and on skin preparation. And that will then allow you to attend our live masterclasses. And microneedling would be a live masterclass. And it would be online. And there would be tests involved, and it's as simple as that. We show you we've got videos of the actual treatment and the mechanisms and how to do everything. So it's a really, really easy process. And once you've completed the initial seminars, if you then wanted to go on to Peels or Cosmolan or anything else, then you can. So if you are interested in, opening an account with us and getting going with this, we will ask you to email us at contact@Mesoestetic, and the process is really, really simple. We will then send you an account inquiry form where we need all your details about your business. Very importantly, we need your qualification information. We're a pharmaceutical brand and it's allowed us to do this online, but there are prerequisites set out by our insurance company with minimum educational requirements, and the minimum is an NVQ level 3 electrical root beauty therapy or equivalent, and we get asked this all the time. So if you've got a level 4 in laser but nothing else, unfortunately you need the level 3 qualification. So we will ask you for evidence of your certificate. So once we've received that, and we'll tell you about all the prices and you're happy with, let's go for it. Then we'll start your training, and once you've completed your training, you can then open the account, and then the products are there like that. So it's a really simple process, and we guide you through it.
Great, thank you. I've just seen if there's anything else more specific. So okay, so you've covered that one. So someone said, as a level 6 student, could I purchase the pen package, or would I have to be a registered business?
You have to be a registered business.
Okay.
Yeah, you can't open with Mesoestetic for personal use, so it has to be a registered business, and it has to be a registered clinic, etc. Yes.
Okay, so that person would, your advice would be when you're set up, when you've done your level 6 and you're set up, and then okay, cool. Is the course insured, or do I need a separate course insurance for this?
When you say is the course insured, okay, so you will get insurance to complete this treatment in your clinic, and your certification from us will qualify your insurance.
Yeah,
so
I think that's what they mean.
Yeah. Or we always advise you to check with your insurance before you commit to anything anyway, just to make sure that you can get insurance and you've got all the prior qualifications. They will want that information that we ask for anyway.
Yeah.
And we can recommend insurance companies to you as well if you get stuck, so you could always email us.
Great. Someone has said, if you already do microneedling, can you buy a package without the m.pen? So I guess the vials.
The package that you would purchase, you would get the m.pen with it. Okay. So it kind of works out that the m.pen is free with the package, so you would get it regardless. So you can either have it as a backup, whatever. But yeah, it's the package is $9.99, and it's all focused mainly on the products. And what's quite nice is the m.pen is included in it. So
great.
Once you've opened an account, let's say you already have a peel account with us, and then you wanted to just purchase some ampules to go with your microneedling device, and that's absolutely fine. But to open in a professional account with us, it needs to be a complete package.
Okay, great. Okay, that one's kind of been done. Do you apply, so this person's asked, do you apply a mask after the needling to finish off the facial? And then someone else has responded to them and said, yes, you do. I think it's called the crystal fiber mask.
Yay! Correct to that person. Yeah, well done. We do. Now, after the treatment, you're red, you're quite hot, and we want to address that. And we use a crystal fiber mask, which is completely sterile. So you've got to be very careful that everything is super sterile. And it's a sheet mask that is drenched in hyaluronic acid. And this is when the client goes, oh, I love you, because it takes that redness down. It's so cool on the skin, so that they're quite hot at this stage, and they just feel immediate coolness, calmness, and it's drenching the skin. So yes, crystal fiber mask. And then after that, that's on for like 5 to 10 minutes. To be honest, the solution drenches in really quickly because the skin's like sucking it in. And then it's removed, and then we have 2 finishing products, and one is a fast skin repair, which repairs the skin fast and creates a nice occlusive barrier to stop any further aggressions. And then of course SPF.
Great, thank you. Something else on rosacea. Could you microneedle a rosacea client in areas not affected by the rosacea, avoiding the areas with broken veins?
Yes, you can. Yeah.
Cool. Okay. Rosacea again. How soon after surgery could you microneedle scar tissue? I'm not really, I guess, what kind of surgery?
Yeah, you'd need to speak to your surgeon. Yeah. They would advise you when, but the skin needs to be healed. So it depends on the kind of surgery. It could be anything between 3 to 6 months after. Okay. It's great if people have had, like, let's say they've had the boobs done and they've got the scarring. It's really quite popular for that, but the surgeon will tell them when the skin is ready to accept any kind of other treatments. So I wouldn't like to say it's a certain time and then that skin's not healed properly. And well, Kat said it's exactly 28 days, here I go. So again, it can be used post-surgery, but it would depend on the surgery.
Okay, cool. Can you use red light therapy after microneedling, so LED?
Okay, this is a really good question. Now, the whole point of of inducing collagen, what happens is you are creating an inflammatory response. There's 3 parts to wound healing, and the first one is inflammation, and that's when you get the redness and the swelling, and all the nutrients flood to the area. Now, what happens is you need that response. You need to see redness, you need to see inflammation, because that then initiates collagen. Now, if you were to put LED on immediately after this treatment to stop the inflammatory response, you have basically then undone the mechanism of the treatment. So with microneedling, you need an inflammatory response. Do not calm it down as soon as you've with like an LED. If you want to use an LED, bring it in a couple of days later. Or I do know clients that will do it first, so they may do the cleanse and the tone, then pop them under the LED, but don't do it after, because it will undo the mechanism. With a peel it's okay, but with microneedling it's not. And I get asked that question. That's a really, really good one. Think about what your LED is doing, and think about what microneedling is doing. In the training, I talk in greater detail about wound healing, and when you understand that, you'll go, oh, I get it. It makes sense. So yeah, we do cover that in the training.
Cool. That's really interesting. I didn't think about that myself.
Yeah.
What would the average cost of a treatment be? So like, for you charging the client.
So the cost to you, you've got £4 for your hair. It's going to cost you around £6 for the mask, £9 for the ampule, let's say 20 to £30. And that's for all your products. And the average price to charge per treatment is anything between £120 and £150 for anything up to 1 millimeter. When you go over that, you're charging around £250 for a treatment. Okay. But you would never sell it as just one treatment. It would always be, it's a program. So you would do a program for whatever the concern is, which would include 6 treatments and their products. So you can, it's better to do it as a program rather than this is a price for one treatment, because if you're selling it as one treatment, they're just going to expect one treatment.
Great, thank you. Kat, give me a heads up if you need to run off at some point, because we've still got quite a few.
It's okay if they're good questions from people. I'd rather answer them for them.
Okay, great, thank you. Okay. Is there enough solution in each vial to treat the whole face?
Yeah, no, we do overfill. So if you're working on a smaller area, you might get 2 applications out of one. On the body ones, you could get up to 4. It depends on the size of the area. So yeah, there's certainly enough to do one face.
Great, thank you. How is the pen holder sterilized?
You will sterilize it with a Sterex wipe. You will do that yourself.
Okay.
You can't get any backflow into the device. It's impossible. On the actual needle head, there's a cap that prevents it. And the needle head goes in and twists, and then you twist. So you will manually sterilize the device. We train you how to do this before and after the treatment in front of the client. Your device will always be sterile. You can cover it if you want to. I do know people that use the sheaths or the tape. You can, but we will train you how to do it properly.
Great, thank you. Can you use the pen with retinol or vitamin A derivatives products?
Yeah, if you know the skin. Again, it would be down to really reading that skin and to see if it can cope, and it would depend on the type of retinol, the concentration, the percentage, etc. Okay, if I'm doing microneedling on myself, my skin is very well prepped. I use products and I have treatments, so it always responds really, really well. It didn't used to, but it does now because it's so well prepped. And I would maybe on myself do microneedling and then finish with a retinol. But I'm not saying that that's what you're going to do on every client. You're going to always proceed with caution when you are playing with retinol.
Okay, good advice. I think we might need to do another session on mesotherapy, you know, because there's a lot.
Okay, you're getting a lot of questions. Yeah,
well, there's a lot asking about the differences between needling and meso.
Yeah, mesotherapy. Mesotherapy basically is injectable in, so you're injecting it into the site, and it's a little rare and often. So with mesotherapy, you would be if you put that into like you'd be inject. Whereas with microneedling, it's create thousands of holes, product in. They're both of them are very popular, and people quite often say, which one would you do over another one? And I can't give you a reason why I would choose one over the other, because I would use them different for different concerns. So yeah, we can do a separate mesotherapy one. We do also, I mentioned our training program earlier, we do mesotherapy training that focuses primarily on the ampules. With mesotherapy, I would always recommend to have true mesotherapy training first. We have an injector gun, it's called the MCT gun. So this is the microneedling device. That's a mesotherapy gun where you put your solution will be in a syringe. It's really, really easy to use, and it will set your depth and your speed, and then you literally inject.
Cool.
So
yeah, that might be handy.
We can do that, no problem.
So it's just on the training again, is there face-to-face training, and where is that held?
At the moment, no, because obviously we're not allowed to do that. We are opening a brand new training facility in Cheshire. And it's one of those things that keeps getting put back. Yeah. So we're hoping it's going to be June, but you know, these things with buildings, they take time. So in the meantime, it is all online, but we are hoping that will change. We always obviously used to go into clinics, but of course I can't commit to anything at the moment because we don't know what the situation is.
Yeah, of course. But so in order to actually pass to get the certificate and pass the training, does there need to be some sort of practical skills checking kind of thing?
No, and then there wasn't. When we do it anyway, we always do a demonstration because of the level you have to be to work with Mesoestetic. You should have the underpinning knowledge and the experience of actually being able to perform these techniques, and that's why the prerequisite of electrical therapy is really important. It's so easy. The actual practical of any treatment is the easiest thing to do. I just think it's the theory and the consultation that you really need to brush up skills with. That's where people are less confident, and it is. But of course, we've got technology like this. You could do the training, then you may think, Kat, can you just watch me do a treatment? And if I can't come to you, then we can use Zoom, etc. So there's means for everything.
Cool. What about? Sorry. What about? First, we have a couple of questions about peeling, which you have mentioned. So someone who may have joined a little bit later said, can we combine needling with peeling? And yes.
Yeah.
And then more specifically, someone's asked what peels can be combined with needling. I have both your pen and certain peels. Wondered if we do the peel first, and what combinations. I'm guessing there's probably quite a few possible combinations depending on the
there are. I mean, I can only tell you how to do it with our peels because we've tested our peels with microneedling. You'd always do the peel first. One peel that I wouldn't recommend is glycolic because it's too fast moving and it can be too aggressive. But one of the popular ones that we combine is Melanostop and also modified Jesner, and that's the Mesoestetic peels. Because modified Jesner, different brands do it, so I can't say go and do it with theirs because their formula could be different. But yeah, we will teach you how to do combination therapies and how to combine a peel with microneedling. I love combinations, so I think you've got your client in the room, get as much done on, in that time that you can, because you're really going to achieve the best results, but you can only do it if the skin is in a really good condition and you're in control of that skin and they've prepped properly. And I would always do a peel first on its own, do microneedling on its own before you combine the two together.
Yeah, that actually answers another question, which is how long before and after Cosmelan would we use the pen?
Right, well, with the Cosmelan, it comes into play at month 4.
Okay.
So if they need it, yeah. Or it's the alternative. If they're not having the Cosmelan, they'll be put on the tranexamic acid route, which is the microneedling and Melanostop peel. And you can do them both together, you can do them both separately.
Cool. If you were just doing a course of needling, what intervals would you leave between their treatments?
If it's up to 1 millimeter, I would do a course of 6, 1 every 2 weeks. If it's over, let's say it's 1.5, so you're doing body or acne scarring, I would do a course of 3, 1 every 6 weeks.
Great, thank you. What's over here? Can you attend the training as a medical doctor?
Yes, absolutely.
Sure you can.
Yay!
Cool.
We have lots of doctors, lots of medics, surgeons use it, nurses, dentists, pharmacists. Yeah, it's a lot of medics that use it. And yes, you are very much welcome.
Great. Okay, questions are slowing down a little bit,
Okay.
so I'll let you go soon.
It's okay.
Can you give us, okay, so back to kind of costing to patients again. Can you give us a sense of cost to patients in London? I know that would be the top end of the scale, I'm guessing.
Yeah, and I will, we'll go through that, but our London trainer, Katie, she will be able to tell you better than me because I'm based in the north. But yes, we can give you an idea of where you are and how much we would recommend for you to charge.
Yeah.
I don't want to say a price now and then you think, well, that's too cheap or that's too expensive because I know your area.
Yeah.
But we can help you with that on an individual basis.
Cool. Okay, is needling recommended for Fitzpatrick 4?
Yes, you can do it on all Fitzpatrick 1 to 6.
Right.
Again, it goes down to the home care. Make sure they're using an SPF. It could be that if it's pigmentation, make sure they've got a tyrosinase inhibitor in their routine. But yeah, it's safe.
Great. Okay, and finally, back to numbing cream, which I think is maybe the question we started on.
Okay.
Does numbing cream affect the results of the treatment?
Okay, it can if it vasoconstricts, because you may not get a true representation of what's happening on the skin.
Okay.
So, for example, if you've got somebody that's quite sun damaged and they've got like quite a thick leathery skin, and you put your numbing cream on and you're doing your treatment and you're not really getting that response in terms of the erythema, it could be because the numbing cream has restricted the blood flow and you're not seeing that true response. So it can, and then you think, oh, I'll just keep going, I'll keep going, I'll keep going, I'll keep going. And actually, you might have done too much. But I can tell you pros and cons to numbing cream. I would use it on an individual basis.
Okay.
Like for years, if it was doing microneedling, like with rolling, oh my gosh, numbing cream all the time, and you wouldn't even get close to me with a roller. But with a device, it's different because of how it works on the skin. It's going in, out like this, and it's not scratching. So it's so much more comfortable. You don't always need it.
Okay, well, I am going to let you go because we answered pretty much everything. There's a few questions I didn't answer, and that I didn't ask Kat, and that's just because I think those are things that you're better off asking, getting in touch with Mesoestetic and asking on a more of an individual basis. So excuse me, sorry, but questions about your specific qualifications or certificates that you hold and whether that will make you suitable for training.
Yeah, we can help you with that.
Yeah, and some more questions about, you know, using the vials separately and packages and things. So please do get in touch with on email, contact@mesoestetic.co.uk. On the screen still you can see the phone number and the social handles as well. The team at Mesoestetic are lovely, so I'm sure they will be able to answer all your questions and give you lots of help.
We will. Absolutely will.
Thank you, Kat, that was wonderful.
Thank you, Georgia. Loved it as always. Yeah, we'll definitely consider doing mesotherapy then next time if that's what people are asking for. So
yeah, and someone did say actually it would be great to see a demonstration. So I don't know whether you've got videos that we can perhaps show.
Yeah, we do. We have videos of everything. So yeah. It's really hard because like I have half an hour to do a little presentation. I don't want to get everything in, and I talk a lot anyway. So to get it all done in half an hour is such a challenge. Where that training would take a full day to do. But
we'll do something on mesotherapy, definitely.
Absolutely. Yeah. Thank you so much, everybody, for
thanks for your questions, everyone.
Yeah, it's been great. So thanks for having me, Georgia.
Of course, pleasure as always. Have a lovely day and a lovely rest of the day, everyone else as well.
Yeah, and have a great weekend.
Oh, yes. Yay. All right. Thanks so much, Kat. See you later.
Bye. Bye, everybody.